Welcome back. Our medical contributor, Dr. Ogechika Alozie with Sunset West Health, has shared his insight with us throughout 2022. And besides talking about COVID, there have been other important topics we've discussed, and we're going to review some of them now in case you've missed them, Doctor. According to AARP, there were 6 most searched topics for health in 2022. What were they?
Yeah, so it's interesting, like you said, we talk about COVID a lot over the last 2 years, and there's a reason why, but it's not all COVID and monkeypox, right? So by AARP, and we put this together side by side with the CDC, it's arthritis. That surprised me, right? Cardiovascular disease, diabetes, cancer, weight loss, exercise, and immunizations, and we're gonna go briefly through each of them.
Now, like you said, it's very interesting that arthritis and joint pain tops the list.
Absolutely. So I am somebody that has a lot of arthritis. I played keeper, I played basketball, had a lot of knee surgeries, and it's amazing to think that almost 60 million people in the United States have arthritis. There's a lot of things that you need to know about how to cope with arthritis. One of them is to be good to yourself, right? You have to find regimens, whether it's heat, whether it's ibuprofen, whether it's not doing certain motions with various joints that protect your wrists, your elbows, weight loss. That's going to be a constant theme today. And I know it's kind of boring, right? People want to talk about the doom and gloom of monkeypox and COVID, but we're going to talk about weight loss a lot. See your doctor, and in as much as it may seem counterintuitive, you got to stay active, because slow joints equal stiff joints.
Now, this is a surprise too. Heart disease number 2 on the list, even though it's the #1 killer of adults in the U.S.
Absolutely, both men and women, African-American women predominantly more so. And I think we've talked about this again throughout the year. One of the things that goes together with heart disease is diabetes. We'll touch on that shortly. But if you have heart disease and diabetes, that's a killer, right? People above 65, 7 out of 10 of them can die from that combination. And so really important to watch out for that.
And diabetes, number 3 on the list of the top health topics.
Yep, and again, so getting older, right? Father Time's undefeated. I think that's one of them. The physical activity is important. We talked about that with arthritis. It's across the board important just for heart health and to keep your weight down, right? And so being overweight, high blood pressure, we just touched on. And if you have a family history of diabetes, you're much more likely to get diabetes. But I think the important thing there is be on the lookout for it, right? You've got an early warning system, and you can do things to prevent it.
Yeah, let's remind everyone about how they can steer clear of type 2 diabetes. We've shown this graphic before.
Absolutely, we have a few months ago. And so when you have those conversations with your physician, if you're in that orange range, especially with the A1C, which is one of the easiest tests we do, once you get above 5.7, you really have to worry. If you're actually diabetic, you have to put a diabetic treatment plan in place, which may need insulin, may need metformin. There are a host of other injectables that actually, some of them now reduce weight loss or reduce weight, and we can talk about those. But again, diabetes is critically important to reduce and prevent to keep you healthy.
Big problem here in the borderlands, certainly. And of course, diet and exercise plays a role in everyone's health every day.
Yeah, the problem is it's easier said than done. Right, we can put up the graphs, people sort of know what it is, but we live in a society, in a world where we struggle for time. I think the sort of common trope about 30 minutes a day is important. I tell people, even if you can't do that 30 minutes, just be active. Try to do something, whether it's walking. There's a lot of research now that high intensity, short periods, 5 to 10 minutes, can be just as good as aerobics for 30 minutes. So whatever you do, get your heart racing. If your heart races, you're getting healthier. And of course, try to eat better. Hard to do right now during the holidays, right? A lot of bichota and a whole host of things, but hey, and I love those too.
Don't park by the front door. Park out in the middle of the parking lot and walk in.
Exactly.
All right, now number 5 on the top 6 list is cancer. One of the most common types.
Yeah, we've talked about cancer. So in women, it's different. It's breast cancer. We've talked about that, Breast Cancer Awareness Month. In men, it's prostate. What they have in common is lung cancer, and that's where we sort of tie into smoking. If you're a smoker, reduce. If you don't smoke, don't start. Host of other cancers, and I think the screening is really what's important for me.
When should people get cancer screenings? And then we're talking about all different types of cancers, of course.
Yeah, so in females, it's at a younger age because they have a cervix, right? So cervical cancer screening between the ages of 25 and 39 is important. Once you get 40 and above, there's a host of cancers that you can see on here. You know, the thing that I see gets missed the most, and it's really disappointing, is colorectal. Right? You want to be able to get a colorectal screening, and it doesn't have to be a colonoscopy. There's a test called a Cologuard, which you can send a sample in and does just as well as a colonoscopy. It's not as invasive, doesn't require anesthesia. You can ship it off, and that can reduce your risk. And so I think that's really important for people to understand and talk to their clinicians about.
All right, finally, the 6th most searched topic, vaccines.
Yeah, so this is unfortunately controversial. Vaccines are not just for children, they're also for adults. But you can see about 15 diseases on this screen that are all preventable. We have vaccines that are targeted to protect you from them. You may get pneumonia, but it's not going to be as severe if you have vaccine. I think that's really the thing for people to remember.
And we also have a timeline to remind adults when to get certain vaccines.
Absolutely. So all adults should think about a flu shot, right? And again, unfortunately, this has become controversial because of COVID, but it reduces your risk of severe disease. We don't want to see you in the hospital, and if we do, always better when I have a patient that's gotten vaccinated against influenza, they're not as sick. Whether it's whooping cough, Tdap, a host of other things. In adults above 60, have a conversation with your clinician about getting that shingles shot. It can protect you, pneumococcal. And then depending on your risk, there's a host of other things. I think, Mark, this has been an amazing year in healthcare, amazing 2-3 years. We have it in our power to protect ourselves from getting sicker. Again, Father Time is undefeated, but we can go gently into the night.
ABC7 medical contributor Dr. Ogechika, Alozie, happy holidays to you. We'll see you in 2023.
Thank you very much, everybody.